protests across the world, demonstrations against vaccination, sometimes peaceful, sometimes violent. Police often have to intervene when protesters without masks and social distancing contribute to the spread of the virus. Debate seems futile for many conspiracy theorists. After all, what do you say to an activist who thinks that Bill Gates is trying to embed secret microchips in people using the COVID vaccine? But where do you draw the line between extremists and skeptics? And how can radicalization be prevented? I'm Daniel Winter. Welcome to our COVID-19 special. Vaccination rates show what the majority of the public believe, that jabs are safe and effective, but not everyone agrees. And of those people, there's a fine line between skepticism and conspiracy. Then there are the extremes. In recent days, several prominent politicians here in Germany were threatened with violence for supporting COVID measures. So why does a loud minority seemingly want to fight for what could harm them or even kill them or their loved ones?
Their views are seen as radical. And although the number of so-called Querdenker or lateral thinkers is relatively small, they're certainly vocal. What do the protesters have in common? One study suggests that in southern Germany they often share esoteric and anthroposophical beliefs. They're generally highly educated, and many are former Green or Left Party supporters. However, in eastern Germany, the far right plays a much greater role. These people lead largely civil and autonomous lives, but now they feel they're being dictated to by the state, although multiple esoteric aspects play a role. But there are clear differences of opinion, even among esoteric thinkers. Tobias Tuchelmann is a pediatrician in Freiburg. He believes in patient autonomy and holistic medicine, but is still vaccinated against COVID-19. Many of his patients are skeptical, but he tries to ease their fears. A common concern is that the vaccines were developed so quickly. Another fear is that people believe that there has to be people out there who have had some negative side effects. I try to reassure them and ease their doubts, also convince them to a certain extent. And when it comes to children having to wear a face mask at school, Tobias Tuchelmann says he won't issue exceptions, especially after a coronavirus outbreak at this nearby Waldorf school infected dozens of children. Authorities later discovered 50 pupils had been issued fake mask exemption certificates.
There are always going to be debates about what's right and wrong to do in a pandemic, but paranoid conspiracy is a particularly dangerous phenomenon. So let's speak to psychologist Annie Stanisko. Thank you very much for joining us. You've written extensively about so-called national narcissism and the spread of conspiracies during the pandemic. What were your findings?
Thank you for having me. In our research, we find that national narcissism tends to be positively associated with the belief in conspiracy theories related to COVID-19. So national narcissism, we can think of it as individual narcissism on the social scale. So it is the concept that people have an inflated belief of how great their country is, but at the same time have also the desire to have that greatness being recognized by others. So we find that...
Sorry, continue.
Yeah, go ahead. Yeah, so we find it is related to the belief in COVID-19 conspiracy theories. And then there's also a relationship through these beliefs to reduce health behaviors to combat the virus.
And where do we draw the line between skeptics and extremists?
That's a good question. I think skeptics are open for different opinions and to consider alternatives. And extremism is more associated with not being open to having discussions and updating one's beliefs.
And how strong are these movements? After all, we can see in most Western countries, the majority of people have accepted getting the vaccine.
Yeah, it really depends. We looked at 56 countries and we saw that there's quite a variance in how popular COVID-19 conspiracy theories are and also how popular this national narcissistic ideas are. So, for example, what we find is that in India and Greece, this idea of national narcissism and consequent COVID-19 conspiracy theory beliefs are actually very high, whereas in Sweden, we see that both of them are actually very low. So we have to look at the countries on an individual scale to understand the psychological processes.
And when you look at the countries on the individual level, or even regions within countries, what are the causes for those differences in the strength of conspiracy movements between different places?
Yeah, so we know that conspiracy theory beliefs are associated with a sense of uncertainty, a sense of having been left behind by, for example, the government. And countries really differ in how people feel about being considered by governmental policies or how good policymakers were in communicating the complexity of the virus.
And what can we do with this research, with the studies that you've been doing and other people like you, into vaccine conspiracy theorists? What are the takeaways and how do we use them?
So I think two takeaways that we found in our research is we have to distinguish between people who are skeptical, as you said, who just need more information about the vaccines, and then people who are strongly conspiracy theory believers who need to be more addressed in their overall motives to believe conspiracy theories, such as feeling out of control, feeling uncertain. So we have to meet these needs before talking about conspiracy theory beliefs with them.
Okay, so it's also about meeting their needs and understanding them in a way as well, and that we can't reach out to them without understanding them. So if there's someone who's watching this right now and saying, here they go, spreading their propaganda again, what is your message to them? Because now you can reach out to them. What would you say to them?
So I think I would say that, first of all, how likely is it that these cover-ups wouldn't have been uncovered yet? When we think about how many people would be involved in covering up that vaccines are actually deadly or harmful, is it really likely that there wouldn't have been a whistleblower just yet? And then on the other hand, also thinking about how many people around me are actually believing it, and how many people might actually just say they believe these ideas to fit in a group. And having an open discussion might be actually very fruitful.
So it seems we have to be skeptical about the skeptics. Annie Stanisko, psychologist, thank you very much for that. That was very insightful. And now it's time for you to ask the questions and for us to reply. Here's a viewer question about whether vaccines can have long-term delayed side effects. Answering it, our science correspondent, Derek Williams.
Has there ever been a vaccine that has caused side effects years in the future?
One of the justifications that people who are vaccine hesitant often give for why they don't want to be vaccinated is that we don't know what kind of effects COVID vaccines might only have years down the road. And of course, that's an argument that can't be refuted because none of us can see the future. We can only make decisions about it based on the severity of the pandemic now and the data that we have at hand. Both as individuals and as societies, it's all we have to go on. It's not a perfect system. Unexpected stuff happens all the time, but it's the only system we have as we seek to stop suffering and save lives. And one great source of data is the information that we've gathered from vaccine drives in the past. That past experience with many, many different vaccines for a wide range of diseases makes a couple of things really clear. First is that given a large enough sample size, some side effects are inevitably going to crop up. Very rarely a currently approved COVID vaccine can cause, for example, someone to go into anaphylactic shock or develop a thrombosis or develop myocarditis. But billions of doses have been distributed so far over the course of nearly a year, and there's nothing indicating any wide-scale trends or delayed term effects for any of the approved COVID vaccines. That's because the experts say vaccines are only given a couple of times and break down quickly in the body after initiating an immune memory, which means if side effects are going to occur, they pretty much always do so within a few days or weeks of vaccination. So while it's true that for a very few unlucky people, a vaccine could cause a side effect that might have an impact on their life for years to come, the experts say there's no evidence linking any vaccine to side effects that only show up many months or years later.
And finally, worries over an Omicron wave have even reached the edge of the Arctic Circle. Tourism operators in Finnish Lapland are still recovering from a disastrous 2020. Now there are hopes and fears as the frosty region's winter tourism season gets underway. At Santa Claus Village Amusement Park, workers are putting finishing touches to this ice restaurant and hotel. But how many guests will experience this fun park is anyone's guess. It's not a case of Finnish restrictions, but other nations' responses to the Omicron variant, including travel restrictions, test requirements and quarantine measures. And that's it from your COVID-19 special. I'm Daniel Winter in Berlin. Thank you for watching.